All right. Hello, everybody. My name is Debbie Delgado from Vista Apex. And yet again, we have the best doctor in the house, Dr. Mike. Thank you so much for joining us. Thank you for helping and joining and giving us a little bit more of your knowledge for our dealer partners out there. Today, we are going to be talking about the Quick Stat Free. All right, Mike, take it away.
All right. Well, Debbie, thank you very much for having me and welcome to everybody watching or listening. So today we're talking about something that every clinician needs to know about, and that is a hemostatic agent that actually works. Because if we don't have a hemostatic agent that works, we're going to have ill-fitting restorations. We're going to be bonding in a sea of blood and saliva, and that's not going to work very well. So what we're going to do is we're going to tell you the best hemostatic agent to use, and that is in my office, QuickStat Free. So what makes QuickStat Free different than every other clear hemostatic agent out there is one, it actually works. Why does it work? Because the other ones are aluminum chloride, but we have aluminum chloride with magnesium in our hemostatic agent, QuickStat Free. But those two things together work well. But the kicker is that Vista Apex has done decades of studies with what we call surfactants. Surfactants break down the surface tension to allow things to mix better. So that's like your oil and water. Oil and water don't mix because of surface tension. But if you add soap, which is a surfactant, it breaks that surface tension and everything mixes together. So QuickStat Free has a powerful surfactant that allows the aluminum chloride and the magnesium chloride to penetrate into the tubules, and that creates a hemostasis and puckers up the tissues, so to speak. So we actually have a clear hemostatic agent that results in 20% faster onset than any other clear hemostatic agent out there that has an ideal gel consistency, so it stays where you put it. And this gives you better adhesion. So when you're bonding a restoration in, you're working in a nice dry environment. When you're trying to get an impression, you're going to get a great impression because you won't have blood around the margins. And the kicker is that you won't have any staining. So to me, this is the hemostatic agent that if your doctor places any type of aesthetic restoration, like an anterior crown, an anterior composite, and they don't want that tissue to look dark or brown when they're done placing that restoration, this is the hemostatic agent they have to use. And I will tell you in my office, because we do a lot of anterior work, this is the only hemostatic agent that I use 99.9% of the time because it does the job and it does it really fast. So in my hands, this is the only hemostatic agent that we use. If you have that case that just won't stop bleeding, sometimes you'll kick into the brown stuff, which is the 15.5% ferric sulfate solution. And with both QuickStat Free and the QuickStat, which is the ferric sulfate solution, I put that on all the cords if I pack a cord. Either one, I use it. Again, the ferric will reduce the sulcular fluids and give you some gingival retraction with the cord. So we have both the clear and the brown hemostatic agent if you want to use it. But again, the only one that I use in my practice is QuickStat Free. If you want more information on why I use QuickStat Free, we do have a program on YouTube that you can watch on the link that we have right here. So hopefully that gives you some inspiration to go show the doctors that they need a hemostatic agent that works without staining the tissue, and that is QuickStat Free.
So, question. Reps. I mean, they're going to come into these offices. What is your one-liner that will seal the deal with the doctors? Coming from the doctor, what would be a good selling, just one quick selling feature for the reps out there?
I think the biggest thing is it's a clear hemostatic agent that works and
Mhm.
doesn't turn the tissues brown. Because when you do it, especially if you're doing an anterior crown
Mhm.
and before you place that crown, you want to make sure there's no sulcular fluids like saliva or blood. I'll go ahead before I do any bonded restoration and I'll take the QuickStat Free and I'll go around that soft tissue, then I'll rinse it off, then I'll do my bonding. And the patients don't want it to see is when they get that new front crown, as they smile and they see the brown at the gum line, because they always ask you, why is it dark up there? And then you have to convince them that don't worry, it's going to go away. It's not going to go away while you're in the office, but it's going to go
Yeah.
away over the next couple hours. With
Yeah.
QuickStat Free, you never have to worry about that. And I get great hemostasis. I get a great astringent action, which means it kind of causes the tissue to pucker up a little bit, and it just works so
Yeah.
well.
And that's that. Yet
That,
again, coming from the Brainiac, Dr. Mike, thank you
that's
so
right.
much. I appreciate your time with us. Once again, this is Debbie Delgado with Vista Apex. Have a great day.